Hi guys, welcome to Dr. A YouTube channel. In this video, we are going to talk about latissimus dorsi. Latissimus dorsi is a large, flat, triangular shaped muscle and it begins from the lower part of the back and attached to the humerus anteriorly. So this is the largest muscle of back. First, let's talk about the proximal attachments of this muscle. So here you can see the pelvic girdle and this part is known as iliac crest. And then the next one is lumbar fascia, also called as the thoracolumbar fascia. So this fascia is a large, roughly diamond-shaped area of connective tissue. Here you can see it. This is the thoracolumbar fascia. So this fascia is a large, roughly diamond-shaped area of connective tissue. So the next attachment is spines of lower 6 thoracic vertebrae. That means from T7 to T12. Here these are the T1 to T7 vertebrae, and from T7 to T12 you can see it here. So the spines of lower 6 thoracic vertebrae, that means from T7 to T12 are the next proximal attachment. So I will write it here. And the next one is lower 4 ribs. Here you can see the lower 4 ribs. And the other one is inferior angle of scapula. Here you can see the inferior angle of scapula. So these are the proximal attachments of this latissimus dorsi muscle. So this muscle originates from these attachments and inserted into the floor of bicipital groove of humerus. As the bicipital groove is in the anterior side, that means the front side of humerus, we can't see it here. So I'll show it here. So this is the anterior view of humerus, that means the front view. So this is greater tubercle and this is lesser tubercle of humerus, and this is the bicipital groove. It is also known as the intertubercular sulcus of humerus. So this is the floor of this bicipital groove. So as for now, I will write it here like this. So this muscle get origin from these proximal attachments and inserted into the floor of bicipital groove in the anterior side. So this is very special, as this muscle get origin from the posterior side, that means the back side, but it get inserted into the anterior side of the body, that means front side. So now let's talk about the innervation of this muscle. This muscle is innervated by thoracodorsal nerve. The roots of these muscles are C6, C7 and C8. And now let's talk about the actions can be done by this muscle. So this latissimus dorsi muscle is involved in several actions primarily affecting the shoulder joint. So the first one is extension. Extension means this moves the arm backward. Okay, this moves the arm backward. So the second one is adduction. Adduction means this brings the arm closer to the body's midline. So the third one is medial rotation. Medial rotation means rotates the arm inward. Rotates the arm inward. Fourth one is depression of the scapula. Depression of scapula means lowers the shoulder blade. So these are the actions that can be done by this latissimus dorsi muscle. And there's some special points to remember, as this muscle is very important in climbing and also assist in deep inspiration. Deep inspiration means the process of taking a very deep breath in, which involves a greater intake of air into the lungs. And the other point is, with the combination of pectoralis major muscle, this latissimus dorsi is a powerful adductor of humerus and also for the downward rotation of scapula. So that's all about this latissimus dorsi muscle. I think you have got a clear idea about this muscle, as these are the proximal attachments, distal attachment, innervation and actions. So if you like this video, please hit the like button and don't forget to subscribe my channel. Thank you guys.